Hi everyone, in this video we'll discuss some important CPC exam E&M practice questions. This is going to be very helpful for your CPC exam because it will give you an idea how to solve questions quickly on your exam by using elimination method. At the end of this video, I will give you some homework questions also. So watch the video till the end. Before that, don't forget to subscribe to my channel and also share it with your friends who want to pass the CPC exam. So let's begin. Have your CPT book ready with you. Let's start with the first question. You can pause the video and try to solve the question by yourself. Let's read the question. A 33-year-old white male was admitted to hospital on this date from the emergency room following a motor vehicle accident to have a splenectomy done. The patient is being discharged from the hospital on this particular date. During his hospitalization, he was experiencing pain and shortness of breath. But with antibiotic regimen, he improved. Physician performed final exam and reviewed chest X-ray that he revealed possible infiltrates and CT of the abdomen, and he was given prescription and he was told to follow up. Physician spent 20 minutes. Select the appropriate CPT code. So let's highlight the main terms in the question. So here he was admitted to hospital on this date from the emergency room and he was discharged from the hospital on this date. As I already told you while discussing the guidelines that if in the question they have mentioned discharged, then you will go for discharge services. You will get an idea by looking at the question. Here they have mentioned, right, the male was admitted to the hospital on this date from ER and then he was discharged from the hospital during this date. And here they have mentioned physician spent 20 minutes. Now let us check the options. Option A 99283. Code 99283 is for emergency department visit for E&M of a patient and low level of MDM. So this is an emergency department visit code. But in our case there is discharge taking place. Okay. So we have to code a discharge code. So we'll eliminate option A. Coming to option B, 99221. 99221 is for initial hospital inpatient or observation care per day for E&M of a patient, which is straightforward or low level MDM, and time is 40 minutes must be met or exceeded. This is only a initial hospital inpatient observation care code. But in our case, there is discharge mentioned. So we'll eliminate option B. Coming to option C, 99231. 99231 is for subsequent hospital inpatient or observation care. That is MDM is low level and time is 25 minutes. But in our case, there is discharge from the hospital on a different day. The admission is on 17th and the discharge is on 20th. So it's a different day discharge question. So by this we'll eliminate option C, which is for subsequent hospital inpatient care. Coming to option D, 99238, check the code. 99238 is for hospital inpatient or observation discharge day management, 30 minutes or less on the date of encounter. So here our time is 20 minutes. And this code 99238 is for 30 minutes or less. So it is matching with the question and also it is a different day discharge code. Remember, codes 99238 and 99239 are for different day discharge. So we will code this option D 99238, which is going to be our right answer. Let us move on to the next question. You can pause the video and try to solve by yourself. Now let us look at the options first. Option A 99221, that is for initial hospital inpatient or observation care per day. MDM is straightforward or low and time is 40 minutes must be met or exceeded. So this particular code is for initial hospital inpatient or observation care. Let us check the main terms in the question. The physician was notified to go to the hospital for medical management of a 56-year-old patient admitted 1 day ago for aspiration pneumonia and COPD. So here the patient was admitted 1 day ago and today the physician was notified to go to hospital for medical management of this patient. So here the MDM was moderate with continuation of intravenous antibiotic treatment. What CPT code should be reported? In our case, the MDM is moderate and it is a subsequent hospital care because the patient was admitted 1 day ago. Right. So we will eliminate the option A because it is not matching with the question. Let us check option B 99231. 99231 is for subsequent hospital inpatient care, that is right. But here the MDM is low level and time is 25 minutes. So in our question, the MDM is moderate. So we cannot code 99231. So we will eliminate it. Coming to option C, 99223. 99223 is for high level of MDM, that is for initial hospital, inpatient or observation care. But in our case, it is a subsequent care. Right? So by this, we'll eliminate the option C. Coming to option D, 99232, that is for subsequent hospital, inpatient or observation care, moderate level of MDM. It is matching with our question. MDM was moderate, right? And it is also a subsequent hospital, inpatient care. So by this, our right answer will be option D. I hope you're clear with it. Let us solve the next question. A 75-year-old established patient is brought in by his son to have a physical screening done to be enrolled in a group home. No new complaints. The patient has established diagnosis of cerebral palsy and type 2 diabetes and is currently on his medications. A comprehensive stent examination is performed and moderate MDM. Blood work was ordered, EPD was done, flu vaccine was given. Patient already had a vision exam. No abnormal historical facts or findings are noted. What CPT code should be reported? Let us check option A, 99397. 99397 is for periodic comprehensive preventive medicine reevaluation and management of an individual, including an age or gender. So these codes are based on age. 99397 is for 65 years or older. So in our question, the age of the patient is 75-year-old. And he has come for a physical screening done to be enrolled in a group. So these codes come under preventive medicine, that is periodic comprehensive preventive medicine. So code 99397 is matching with our question. We'll keep this for now. Let us check option B also. We should try to eliminate other options as soon as possible. So we'll check option B, 99387. 99387 is for 65 years or older, initial comprehensive preventive medicine, that is for initial. But in our question, they have mentioned the established patient has an established diagnosis of cerebral palsy and is an established patient, right? So it is not a initial comprehensive preventive medicine evaluation and management. So by this, we'll eliminate option B. Coming to option C, 99212, check these two codes, 99212 and 99213. These codes are for office or other outpatient visit for ENM of an established patient who is having MDM straightforward and 10 minutes must be met or exceeded, 99212. 99213 is for outpatient visit, ENM, low level of MDM. But in the question, the patient has come for periodic comprehensive preventive medicine. Here you can see, brought by his son to have a physical screening done to be enrolled in a group home. No new complaints and he has established diagnosis. So this is not for office or outpatient visit. So by this, we'll eliminate option C and option D. We are left with option A, which is our right answer. Next question. Tracy, a 59-year-old female, arrives to the cardiologist office for a cardiology consultation. At the request of her primary care physician, he carries out his consultation and took a history and exam and dictated MDM of moderate complexity. He reports his findings to Tracy's PCP via phone and letter. So we have to code for the ENM service. Let us check option A, 99244. 99244 is for office or other outpatient consultation for new or established patient. MDM is moderate. In our question, we already marked consultation. So this is a consultation code because you can see here there is consultation at the request of her primary care physician. We already discussed this while studying guidelines. So here we have to code consultation code. So our option A, 99244 is the right answer. We'll keep this for now. Let us try to eliminate other options. Check option B, 99254. 99254 is for inpatient or observation consultation, moderate level of MDM. But in our case, it is not inpatient consultation. Here they have mentioned cardiologist office, right? So it will be an outpatient consultation. It is not inpatient. So by this, we'll eliminate option B. Coming to option C, 99214. 99214 is for office or other outpatient visit for ENM of established patient, moderate level of MDM. It is not a consultation code, but in our case, we have to code consultation. So by this, we'll eliminate option C. Coming to option D, 99245. 99245 is for office or other outpatient consultation. MDM is high level. But in our case, the MDM is moderate level. So our right code will be 99244, not 99245. So we'll eliminate option D. We are left with option A, which is our right answer. Let us move on to the next question. This is a straightforward, easy question. So try to solve it by pausing the video. Let's continue to discuss. An office physician provided high complexity MDM for an established patient. High complexity MDM for an established patient based on documented history and medically appropriate physical examination. Choose the CPT code. Option A, 99215. 99215 is for office or outpatient visit, E&M of an established patient, high level of MDM. In our question, it is high MDM, established patient. So it is matching with the question. We'll keep this for now. Check option B, 99245. 99245 is for office or outpatient consultation for new or established patients. So it is a consultation code. In our case, there is only outpatient visit. It is not a consultation code. So we'll eliminate option B. Coming to option C, 99205. 99205 is for office or outpatient visit for E&M of a new patient. But in our case, the patient is established. So by this, we'll eliminate option C. Coming to option D, 99214, that is for office or outpatient visit, established patient, that is correct. But here the MDM is moderate level. Okay, in our case, the MDM is high level. So by this, we'll eliminate option D. We are left with option A, that is our right answer. If you have any doubts, don't hesitate to leave a comment below. So this is a homework question for you. Try to solve it by yourself. We are going to discuss it in the next video. I will give you 2 homework questions. This is question 1. This is your homework question 2. That's it for today. In the next video, we'll discuss some more CPC exam practice question related to E&M. And we'll also discuss this homework questions. So stay tuned and don't forget to show your support by liking, sharing and subscribing to my channel.